Welcome to the Blue Star Report. I'm Brad Walker. Today, the Dallas Cowboys got some bad news about two of the fan-favorite rookies. Linebacker DeMarvion Overshown and tight end John Stephens Jr. both have torn their ACLs in Saturday's game against the Seattle Seahawks. Michael Gehlken confirms that Overshown has tore his ACL and is done for the season. Multiple sources have, also, confirmed that John Stephens Jr. is done for the year with a torn ACL. Both showed glimpses of greatness. While I wasn't sold on Stephens making the team this year, I saw those glimpses of greatness as well. However, I was sold on Overshown and I did see him lining up next to LVE this year. But the season goes on. I'm confident in saying that we will see them making the team next year. At this time, I would like to explain the injury, what it is, why it happens, and how long it takes to heal. If you want a more in-depth explanation of the injury, you can always go to WebMD. But I highly recommend subscribing to these two channels, The Fantasy Doctors and Brian Stutter MD. They probably do a better job explaining it than I do. Links will be in the description below. First off,
what is an ACL?
An ACL, or anterior cruciate ligament, is an important part of your knee structure. It's a tough band of tissue that connects your thigh bone, femur, to your shin bone, tibia, inside your knee joint. The ACL helps provide stability to your knee and controls its movement, especially when you change direction quickly, jump, or pivot. It's like a strong rope that helps keep your knee from wobbling too much and helps you move smoothly.
Why does it tear?
An ACL tear usually occurs when the ligament is subjected to forces that are too strong for it to handle. There are a few reasons why the ACL can tear. 1. Sudden changes in direction. When you make a sudden and sharp change in the direction you're moving, your knee can twist or turn abruptly. If this happens while your foot is planted on the ground, it can put a lot of strain on the ACL, potentially causing it to tear. 2. Deceleration in landing. If you're moving quickly and then suddenly stop or land awkwardly, the impact and pressure on the knee joint can be enough to damage the ACL. 3. Excessive force. A direct hit to the knee, like in a collision or tackle, can generate a significant force that stretches or tears the ACL. For hyperextension, if your knee gets bent too far backward, it can also overstretch the ACL and lead to a tear. 5. Weak landing technique. In sports that involve jumping and landing, improper landing technique, such as landing with a locked knee, can increase the risk of ACL injury. 6. Muscular imbalances. Weak or imbalanced muscles around the knee can affect the way your knee joint moves, potentially leading to a greater strain on the ACL during certain movements. 7. Non-contact injuries. Sometimes an ACL tear can occur without any direct impact or collision. It can happen during activities that involve sudden and forceful movements, putting excess stress on the ligament. Overall, an ACL tear typically results from a combination of forces, movements, and circumstances that cause the ligament to become stretched or torn. It's important to note that prevention strategies, such as proper training, conditioning, and technique, can help reduce the risk of ACL injuries.
How long does it take to heal?
The time it takes to heal from an ACL tear can vary based on several factors, including the severity of the tear, the individual's overall health, the type of treatment received, and how well they follow their doctor's recommendations. Here's a general timeline for healing. 1. Immediate aftermath. Right after the tear, there is usually swelling, pain, and limited mobility. This acute phase can last for a few days to a couple of weeks. 2. Non-surgical treatment. If the tear is partial or the individual's lifestyle doesn't require a fully functional ACL, they might opt for non-surgical treatment, which includes rest, physical therapy, and strengthening exercises. Healing and regaining strength can take several weeks to a few months. 3. Surgical reconstruction. For many active individuals, especially athletes, surgical reconstruction of the ACL is recommended to restore stability and function to the knee. The surgery involves replacing the torn ligament with a graft. After surgery, the initial recovery period lasts a few weeks, focusing on reducing swelling and regaining knee movement. For post-surgery rehabilitation, physical therapy is a crucial part of recovery after ACL surgery. The length of the rehabilitation process can vary, but it typically lasts around 6 to 9 months. This period includes gradually increasing the intensity of exercises, working on strength and flexibility, and regaining balance and coordination. 5. Return to sports. 7. Depending on the individual's progress in the sport they play, they may be cleared to return to their sport anywhere from 6 to 12 months after surgery. It's important to ease back into sports activities gradually to avoid re-injury. It's important to remember that everyone's healing process is unique. Following medical advice, attending physical therapy sessions, and maintaining a healthy lifestyle can all contribute to a successful recovery. Always consult with a medical professional for personalized guidance on healing from an ACL tear. I hope that helps you understand the injury better. I'm Brad Walker, saying until next time, please love everyone that you can.